Hey everyone, my name is Dr. Jocelyn Conley, pelvic floor physical therapist, and in this video I'm going to talk about pain with sitting and hip pain during sitting, and I'm going to give you tips on how you can immediately reduce certain types of hip pain if this is relevant to your life. So first of all, just take a look at how I'm sitting right now. If you could see me from the side, you're going to notice that my back is in more of an arched position. My heels are off the ground, and if I had my desk in front of me, I'd be in my typical stressed out position where everything's tense. What you see right now is I am overly active through my hip flexors in this seat. On top of that, my hip motion is like, if I took a measurement of this, I wouldn't be at the end of my hip flexion range of motion, but I'd be pretty close to it because of how much muscle activity is going on. So basically, the structures in the front of my hip, whether it be tendons, other supportive connective tissue, or muscles, nerves, those tissues can get compressed either right here or as they go through the rest of my body to the spine. So the solution for this is to relax your dang hip flexors. My first suggestion is get in a seat or get back in your seat so that you can just let this area relax, and then let your abdomen relax as well. The problem, in rehab, I do think about, okay, we want to balance hip flexors with abdominals. But in this sitting position, we don't really want either of those muscle groups gripping so much. It's just unnecessary. So first step is relax those areas. And right now, because of this type of chair, which isn't that great from a support standpoint, but my feet are hanging, I would want to get my feet elevated a little bit so they can be flat. So this already instantly softens a lot of things in this hip girdle region. When it comes to driving, a lot of people lift their leg up to change from the gas to the brake. Instead of lifting, you slide. Keep your leg heavy on the ground and just slide so that you're not unnecessarily recruiting your hip flexors, which in a lot of people I see are chronically strained because of crappy deep core connection, and therefore an imbalance to the whole deep and outer core system. So in the meantime, you should see someone that can teach you how to effectively stabilize through a strong, solid, but adaptable foundation so that you're not just using a portion of your hip flexor and having another portion of your hip flexor muscles in a chronic inflamed state because of ineffective use and abuse, essentially. The other thing I want to talk about is if you have tailbone or butt pain with sitting or during standing. In this case, what I typically see is those people, sometimes it is similar. They need to just relax their abdomen and their hip flexors and just get better support in their seat and do some work on stress management with work. But often they're in a more rounded slouch position, and their pressure is not through their sit bones, but it's they're doing what we call sacral sitting. So they're sitting on their sacrum. In addition, all of these structures in the back of their pelvis and their spine are rounded and getting more pressure through the discs of the spine. So the fix for them would be to get out of this position into a more neutral position onto their sit bones. But even so, we don't want you to be gripping onto your hip flexors, because that can also aggravate the issue. In this case, you want to look to find a seat where your thighs are more parallel to the floor or slightly below. This is often something that I find like people will round when they're really stiff through their hip joints. Those people sometimes have a structural problem, other times it's just lack of mobility that can be improved over time with proper training and loading and so on. When this becomes, so let's talk now when they get this butt pain and standing. At least in my population, and there's a lot of presentations, so I don't want you to think this is for everyone. But dancers specifically are people really flexible in their hips. Like, tell them to bend forward, and they bend forward and they're really super flexible. I'm pretty decent, but not like some of these other people. And they're bending all through their hips, and their lower back is just not rounding at all. And what's happening is they're getting so much stretch to the posterior part of their hip capsule or different structures of their pelvis or SI joint. And it's like that region is the path of their least resistance, and their lower back is too stiff. So the body naturally goes to the easier part and doesn't round in the other part, so the load isn't spread. So the fix for that is when you're bending, yeah, I still want you to bend through your hips, but also don't just beat the heck out of your hips. Teach yourself or find someone that can teach you how to round and balance out this bending across the rest of your body. Now, this could be the opposite, where you're not moving in your hips at all, you're just moving in your low back. And in this case, we need more hip movement to balance out the spine motion. Now, if this is the problem with more dynamic movements like walking or squatting, and again, I'm a pelvic floor physical therapist that primarily works with postpartum women, so what I see in my population might be different than, some other provider. What I see is is a recruitment imbalance in their hip and thigh and leg muscles. And so when they go to straighten their leg, as in while they walk, or just like this is closed kinetic chain movement, this is open kinetic chain movement, they're using the wrong, I don't usually say wrong and right, but they're using the wrong strategy to extend their knee. They're using excessive contribution or excessive hamstring involvement alongside with some quads. So what's happening is their femur, this bone, is being sucked up into the hip joint, which puts a torque across the SI joint. So the SI joint are these joints here where either side of the pelvis comes together. And that's a problem for a lot of people that are not necessarily balanced from a muscular standpoint after birth. So the fix for that is teaching people how to use their muscles and time them appropriately so that they're not getting this repetitive glide in their hip joint. So notice I talked about the hip and the pelvis. People often don't know how to say, oh, it's my back, or they're like my butt. It's hard to describe because it's both the hip and the SI joint, and your SI joint attaches to the low back, so it's like kind of everything. The other thing is lack of recruitment of the glutes at the right time. So your glute muscles are really great at distributing the force well and across your body in the ideal circumstance. When is it ideal? I don't know. But let's say if I have people stand up and they stand up and I'm like, what's your strategy? And they're like, I don't know, I just stood up. And I'm like, what'd you do with their breathing? I'm like, I just held my breath. They usually hold their breath. But even after that, after I get them breathing, and I'm purposely psychotic about breathing because of its effect on the tailbone and therefore the SI joint and the spine itself, the second thing is glutes. So I teach people how to initiate with their glutes, because if not, what happens, either they hoist themselves up from the ground just by leverage, or they use part of their hamstrings to initiate. Let's say if one side, if you have any imbalance, you're going to have an imbalance force going across your SI joint, which can provoke your symptoms or flare something like sciatica up. So instead, if you can learn how to get a more balanced force across your pelvis, you're going to have less torque on your SI joint and therefore less butt hip symptoms. So I covered a lot in this video. We started off with sitting. Relax your dang hip flexors and your abdominal wall. I promise no one's judging your belly. Get in a better chair and change your positions every 20 to 30 to 40 minutes throughout the day. Second is, if you tend to be a sloucher, stop sitting on your sacrum, get up on your sit bones, make sure your thigh is parallel or lower than the chair height. Third is, when you are walking and just moving throughout the day, be mindful of, like, how are you walking? Do you notice your butt pain with walking or your hip discomfort while walking? You might need to adjust your step length. Maybe shorter steps is usually what I'm seeing, but sometimes it's maybe use your feet, like actively use your feet. And then with everyday movements like standing up from a chair, standing up from a forward bent position, take note. Are you someone that just moves through your hips? Are you someone that just moves through your back? Try to balance those out, and then be aware of your breathing mechanics during those movements, and then how you get from A to B. And usually, if you don't have a strategy, one start, it doesn't work for everyone, is to initiate with glutes from a bent or a hip flex position if it's a squat, because that just gets the chain flowing much more balanced and optimally than if you don't have any strategy at all. So if you have any questions, please comment below. If you know anyone that could benefit from watching, please share. If you like this, press the like button. And then if you're not already subscribed, be sure to subscribe so you're notified every time a video is dropped. Thank you again. My name is Dr. Jocelyn Conley, pelvic floor PT, physical therapist. I'll see you next time.